Good morning, and could I start by offering my condolences to those families that lost loved ones. You remain in our thoughts and prayers. Up to 8 p.m. last night, Western New South Wales Local Health District, there were 27 new cases. 17 of those cases were in the Dubbo local government area, 6 in Burke, 1 in Walgett, and 3 in the Bathurst local government area. In the Far West Local Health District, there were 7 cases. All 7 cases were in Wilcannia. In the Illawarra Shoalhaven region, overnight there were 34 cases. 24 cases were in the Wollongong local government area, 7 cases in the Shoalhaven local government area, 2 cases from the Shoalhaven local government area, and there's 1 case currently under investigation in the Kiama LGA. In the Hunter New England Local Health District, we had 11 new cases overnight, 3 cases in Port Stephens local government area, 2 are in the Newcastle local government area, 5 from the Lake Macquarie local government area, and 1 from the Dungog local government area. Also on the Central Coast, 15 new cases on the Central Coast at 8 p.m. last night. Southern Highlands, we saw 5 new cases in the Wingecarribee Shire. 4 of those cases were in Woodlands and 1 case in Mittagong, in the Mittagong area. Southern New South Wales, there were 0 cases to 8 p.m. last night, but we've already been notified this morning. There are 2 additional cases, 1 in Batemans Bay, 1 in Cooma. The Bateman Bay's case is a close contact of a previous case that was announced a couple of days ago. Again, a call out to the community of Forbes. Fantastic result in the past 7 days. They've moved their first dose vaccination rate from 36% to 63%. And again, a call out to regional rural New South Wales is to get vaccinated. Walk-in clinics without bookings are becoming more available right across the region. Jump on the New South Wales website and find out where you can get the jab. Thank you.
Good morning, and thank you very much, Premier, for the invitation to attend today. From the National Centre for Immunisation Research and Surveillance, it's been our pleasure to be working very closely with the Ministry of Health, the Department of Education, and indeed principals, schools, directors and childcare centres, as well as, of course, families and kids, to be able to track the spread of COVID in educational facilities across New South Wales. We've actually been doing this since the beginning of the pandemic in March 2000 last year and delivering reports. Today we're releasing the 5th of those reports, which saw us cover the period from mid-June through to the end of July, 6 weeks, during which there were cases of COVID in 51 educational facilities across New South Wales. Important to note that there are almost 9,000 facilities, I think 3,100 schools and around 5,800 childcares. So of those 51 sites where there was a case, there was actually the majority that did not have any onward spread of the virus to teachers, staff or children in the educational facilities. What we saw was that the highest rate of spread was actually amongst unvaccinated adult staff, and particularly unvaccinated adult staff at the time of the report in childcare centres. The spread of virus also occurred from adults to children, but the spread between children themselves was very low. This really affirms what we know about the Delta virus. We have seen a higher rate overall of spread from the Delta virus as compared with what we saw last year, but in children in particular, the majority of children who have become infected have not had symptoms or had only mild symptoms.